It's a Wednesday morning. Welcome to the AM News here on the AM Show. My name is Kwesi, Schandorf. Now, the minority on Government Assurance Committee of Parliament is pushing back on claims that government is struggling to fix roads due to the lack of support for the e-levy. Roads and Highways Minister Kwesi appeared before the committee to provide an update on promises he made to members of parliament regarding some road constructions nationwide. The minister explained more roads will be fixed if Ghanaians support the e-levy, which is currently doing less than 7% of government's target. Parliamentary correspondent Kwesi has more in the following report.
Government has touted the last few years as the years of roads and touted what they called a significant achievement in the sector. But government now admits there is still a lot of work to be done given the number of roads that are still in a terrible state. Roads and Highways Minister Kwesi says if Ghanaians supported the e-levy, more roads can be fixed.
Pay taxes and contribute to infrastructure, so that if we pay taxes like the e-levy which was introduced, if it's supported, one of the key areas for the e-levy was the road sector. So if it had been, for instance, supported and we could have, it could have helped. You understand?
The government has currently received less than 7% of the originally projected 6.9 billion cedis it intended to raise from the e-levy. Government has raised less than 100 million. The minister also admits the challenge is due to unreleased budgetary allocations.
Your statement is true. I want to confirm your statement that we all know that, we do not get all the releases, as per the appropriation that we passed, and because we know the challenges, and it's not limited to any particular government, it's not limited to any particular ministry.
But the NDC MPs on the Government Assurance Committee have been hitting back at the responses from the minister.
I don't think the minister even in the first place had to say that. Because he cancelled the road tolls. And so if he knew we needed money to do all these things, why did he even in the first place cancel the road tolls? I remember in December when I encountered him regarding my roads, he told me, that honorable member, that is why we are asking you to approve the e-levy for us. As we speak now, is the e-levy not approved? And so he didn't even have to talk about it.
I wasn't too much impressed. All borders on the fact that it is about funding. But our issue is not about funding, it's about promises made by he himself on the floor of the House, and whether those promises have been fulfilled or not, as in accordance with our standing orders. Now, if he has made a promise, it means that he knows that there's funding for it or there's no funding for it. For him to come back and ask for another assurance within assurance, what is the guarantee that funds will be made available? So I'm not impressed at all. We are not here to play. We are not here to also witch hunt. We are not here to lay the blame on any of the administration. But the e-levy has been passed. I mean, if he's talking about e-levy, it's been passed. So why is it not getting the funding for it? It means that government has not done its homework well. If government has done its homework well, they will not put all their eggs in one basket, which is called the e-levy.
Thank you.
He comes, try to give promises, but these promises are never adhered to. But let's hope that this time around the right thing will be done, because he's meeting a committee.
They have specific concerns with the responses of the minister. They say they are going to push to ensure that all these promises he made on the floor of the House, as well as the promises he made here at the Government Assurance Committee, will be met. They are also not satisfied with the minister blaming the underperformance of the e-levy. They say, well, they told the government that e-levy wasn't going to perform so well. The Minister for Fisheries, Hawa Kumsin, and Local Government Minister Dan Botwe are expected to appear before the committee on Wednesday after failing to do so last week. For JoyNews, Kwesi, Accra.
Now, still in Parliament, Health Minister Kweku Agyeman-Manu was on Tuesday confronted with documents showing that the Bank of Ghana sought authorization from his ministry to pay an ambulance supplier. Mr. Menu had in his testimony insisted he was not aware of the existence of any document indicating such a request or approval by the Health Ministry was done during the John Dramani Mahama administration. All this played out when the Health Minister was cross-examined by lawyers for former Deputy Finance Minister Dr. Kesel Atu-Forson. Court correspondent Joseph Akablay has the rest of the story.
Dr. Forson and two others are accused of causing a 2.3 million euros financial loss to the state in the procurement of ambulances. The health minister had earlier told the court a letter written by Dr. Forson asking the Bank of Ghana to issue letters of credit for the supplier is what resulted in payments contrary to the agreement. He insisted that the contract barred payment before delivery. The developments he had explained created a situation where defective vehicles were supplied even though monies had been paid. Dr. Forson's legal team, led by Dr. Abdul Basit Bamba, on Tuesday cross-examined the minister. They asked whether he was aware of the fact that the Bank of Ghana had requested authorization from the Health Ministry before such payments were made. Mr. Ajimamenu said he was unaware and had not cited any such documents since taking office in 2017. Hours later, he was confronted with a document showing a request from the Bank of Ghana to the Health Ministry for authorization. The minister admitted the letter showed a request but insisted Dr. Forson's earlier letter is what resulted in the establishment of the letters of credit. The minister is the fourth of the Attorney General's 5 witnesses and will be back in court on Thursday, September 1. The former Deputy Finance Minister's legal team is expected to complete the cross-examination to enable other defense lawyers undertake cross-examination as well.
Now, have you been experiencing a state of complete body immobility, yet you're widely awake and it is making you extremely anxious and depressed? Well, doctors say there is no cause for alarm. You are merely having sleep paralysis. Jesse Sewabuafu speaks to a doctor in the following report.
Sleep paralysis is transient inability to move or speak while falling asleep or upon waking up. According to medical experts, it is purely a natural episode in the rapid eye movement stage of sleep. Stress, inadequate and inconsistent sleep patterns, and certain medications have been identified as possible causes. The general lack of knowledge about the experience, however, is causing some people to resort to unorthodox means of treatment. Others also attribute it to spiritual machinations. Here are some views from parts of Accra.
You are asleep and you feel like waking up, but you can't wake up. You can't even move your body.
It was frustrating. I wanted to get up so badly.
Someone was following me like a monster in a black. Use the word Jesus Christ on the person.
I have the assumption that there's a spiritual presence around and somebody's trying to cover me. And mostly I'm trying to say Jesus, and I'm not even able to utter a word.
To me, I think it's tiredness.
Doctors, however, explain that there's no cause for alarm. With enough rest, one can check the occurrence of sleep paralysis. Dr. Yain Fojo is a sleep specialist at the Brain and Mind Center at Abokobi. He talks about the stages of sleep.
There are two types of sleep. There's a non-rapid eye movement and there's a rapid eye movement sleep. In the rapid eye movement sleep, you have a couple of things that happen. 1, dreaming. 2, rapid eye movement. 3, for males, erections. 4, the brain is all over the place, including active dreaming. 5, muscle diaphragm movement. 6, complete paralysis of all the other external muscles. It is part of the rapid eye movement stage of sleep.
Dr. Fojo reassures that sleep paralysis is nothing spiritual.
So it is not that something is causing it. No, that is completely wrong. Just to reassure people, it's a normal state. It happens to everybody. There is no spiritual connotation to it at all.
Though experienced by all age groups, sleep paralysis is common in men. Jesse Sewabuafu reports for JoyNews.
Now, the Driver and Vehicle Licensing Authority, DVLA, is strengthening its eye testing regimes to enhance safety on the roads. According to the authority, the present order, where staff without the necessary qualification administer the service, has proven ineffective. Therefore, beginning September 2022, all services requiring eye tests for applicants will be done by certified optometrists. Nanaya Ojiba has more in the following report.
The new eye testing regime hinges on Regulation 29 of the Road Traffic Regulation 2012, which requires all prospective applicants for driver's license to use the services of only registered optometrists or ophthalmologists and the designated facilities. The DVLA believes basic eye tests conducted by the authority over the years have not fully revealed eye defects of drivers.
The current administration of the eye tests has certain limitations, simply because it is done by the DVLA staff. And these are not people who have the right competencies, knowledge and skills for undertaking the test to the level that will show certain eye challenges if a driver should have it. And of course, the basic test also, we have found out that does not give the full condition of a driver's eye.
Statistics from the National Road Safety Authority show 1,300 persons were killed in road accidents between January and June this year. Within the same period, 7,997 persons sustained various degrees of injury. Though the accidents are not linked directly with poor vision of drivers, the DVLA believes improving the standards of tests can improve conditions on the road. Kafui Semevo is Director of Driver Training, Testing and Licensing.
The essence of this is not to deny people driver's license, but it's to ensure that when you are licensed to be in the public space, you have met the minimum requirements and you are safe yourself. Your other road users are safe when you are around them. Those are some of the benefits. The other thing is that because we are receiving these reports electronically, it creates opportunity for the DVLA to now look at another service of renewing the driver's license online. We've not gotten there yet, but it's a very good opportunity this reform is bringing. So we are looking at it. When the time comes, we will let the public know what to do.
The reviewed process will ensure certified members of the Ghana Optometric Association perform the eye test on behalf of the DVLA. Results delivery in this system will be digitalized to deal with possible doctoring of the results. Meanwhile, the Ghana Optometrics Association explains some new tests will be added to the process. Dr. Remy Ningpe is president of the association.
Some of these tests include things like color testing to enable drivers be able to see well with colors, the traffic lights, the road signs and signages on the road, so that they are sure that they are seeing and are being seen well on the road. We are also going to test and make sure that drivers who probably would have had some conditions that will prevent them from seeing well in the future, identify them now and be able to solve them. Just a few people here, we can notice one or two people already wearing glasses. That enables them to see better. How many of our commercial drivers do you see wearing spectacles? Is it that they are all very good sighted people?
Still in the bulletin, the Medical Superintendents Group of the Northern Region is conducting free medical surgeries for patients with hernia, obstetrics and gynecological conditions in the Nanumba North Municipality of the Northern Region. The group says the area has a high prevalence of these conditions. 75 residents have already undergone surgery. Martina Bugri reports.
The Nanumba North Municipality has a population of over 160,000 people with just 2 doctors serving the hospital. This is said to be putting pressure on the 2 doctors. It's against this backdrop that the group decided to begin the maiden outreach exercise in Bimbila, where the cases are huge. Speaking to the media, the president of the Medical Superintendent Group, Dr. Abdullahi Seydou Ayuba, said they decided to do the surgical outreach to address some of the surgical needs of the people in the municipality.
Having seen that most of our patients really are not having the surgical needs, or the surgical needs are not met in the periphery. And you know, the northern region over the years has been without enough doctors, and very few doctors are around. It means that the people are not be able to be served well because you cannot clear. So in line with this, the medical superintendents group of the northern region decided to do this surgical outreach just so as to be able to clear some of the surgical needs of people.
Lead surgeon of the group, Dr. Bashiru Abdul Majid, said hernia is the common disease in the area, affecting men who are mainly farmers. This, he said, is affecting productivity.
The commonest surgical problem within this area is hernia. It is because of the hard work people do. It's one of the risk factors. Okay, when you are doing a lot of manual work, it's a risk factor for hernia. And when you get a hernia, it affects your output. You often get pain and discomfort from the hernia, and you are not able to do serious work.
Medical superintendent at the Bimbila Municipal Hospital, where the surgeries were undertaken, Dr. Barhama Adam, said the municipality has just 2 doctors instead of the 10 posted to the area. This, he said, is affecting healthcare delivery.
There are quite a number of challenges. Okay, one of the biggest challenges we have here is, our numbers. Okay, you can imagine a district of over 160,000 population served by only 2 doctors. We have only 2 doctors serving a population of over 160,000. Okay, so certainly it comes with a lot of challenges. Okay, last year or so, I think the national sent about 10 doctors. Out of the 10 doctors, I think it was only 1 or 2 who reported. Okay, the rest never came. Okay, so these are the challenges that we have as a region.
The Rotary Club of Ho is funding the construction of an information communication technology laboratory for the Dodomi Avexa DA Primary and JHS project as part of a series outlined by the club for the 2022-23 Rotary year. Here's a report by Fred Kwame Asari.
The Rotary Club of Ho Presidential Ball and Fundraising Dinner was held at Sky Plus Hotel in Ho. It was attended by members from Rotary clubs from Ghana, Togo, Benin and the USA, Retract clubs, Lion clubs and well wishers. The objective was to make merry, socialize and solicit funds to undertake this year's flagship project of the Rotary Club of Ho. Simon Fafali Awume is the president of the Rotary Club of Ho.
I am also happy to announce that the flagship project of the year is a 30-unit computer lab project at Dodome Avexa Primary School and JSS. There couldn't have been a better time than now to direct our resources to the use of technology. Many things we do, especially in education. COVID-19 has taught us how much enough it is to use technology.
The district governor nominee, Engineer David Osei Amankwa Jr., who was the guest speaker, lauded the initiative and implored the gathering to donate generously towards the project.
The 30-unit computer laboratory is expected to be fitted out and donated to the school after this successful event. And it is indeed very commendable and will impact very positively on their ICT knowledge, acquisition and skills improvement. And as my commitment to the Dodome project, I pledged, or rather I'm donating 10,000 Ghana cedis.
The special guest of honor, Roxanne Kwesi Dobega, relaunched the Rotary Education Excellence Award scheme aimed at improving academic performance. He donated 10,000 Ghana cedis towards the flagship project.
The main objective of the Rotary Education Excellence Award Scheme is to motivate basic school teachers in the region for higher commitment to service and professional performance. It also aims to foster competition for academic excellence among schools, pupils, and teachers in our basic schools.
The Volta Regional Minister, Dr. Archibald Lecha, assured of his support for the success of the flagship project.
I wish to assure the club of my support, both in kind and in cash, and commitment toward the achievement of the great targets for the year under consideration. You see, we have had two special guests who have made their announcements, and I am like a subsidiary speaker. So I don't want to give anything more than 10,000 cedis.
An amount of 82,000 Ghana cedis was raised through personal donations and auctions to finance the provision of a 30-capacity ICT lab for the Dodome Aveha DA Primary and Junior High Schools. Fred Kwame Asari, JoyNews.
And on that note, it's a wrap here on the news. My name is Kwesi Schandorf. The show continues with Benjamin and Bernice. You have a blessed day.